Okay, so tonight's class, we're going to talk about social and behavioral constructs in the world of public health. In the world of public health, we aren't just selling a product. We're really just safeguarding about a human right. The right to do effectively what an organization needs. So that's called, the strategic compass. It's the set of defining statements that align a daily operations with long-term aspirations. When we look at the core values and the foundations of an organization, it's just before a word is written for a mission statement, there's these core values. And these are the fundamental beliefs of an organization. In public health, these are often include the equity, the social justice, the evidence-based practice, the community empowerment that they believe in, what they think their values are. It's kind of like the soul of that organization. It's what they dictate, how they work. For kind of example, it's like how they choose their priorities and kind of like that underserved rural population, because equity is their core value, if they will. The mission is a concise explanation of an organization's reason for existence. It describes what the organization does, who it serves, how it serves them right. The public health context, it focuses on the current functional role, such as disease surveillance, health education, or policy advocacy. The example that I would use when looking at this is to protect and improve the health of all residences within that city, through disease prevention, health promotion, and of course the assurance of the access of quality health care to all people in that population. When we're looking at the vision statement, it's really the aspirational of that organization itself. It's the mental picture of what that future looks like for that organization. It's 100% that organization's success. It's like the North Star, where that organization is planning on going. In public health context, it's the sector, the vision. It's often bold. It's very idealistic, if you will. It's the ultimate goal. It's the eradication of suffering. We're going to take care of everybody in this organization, of this entire community that we're going to serve. It's how our organization is going to build. It's where we're going to go. It's how we're going to get there. So like an example of what they're going to do is like, a community where every individual has the opportunity to achieve their highest level of health and well-being, free from preventable disease, kind of thing. So when you're out there in the practicum site and you're looking at your organization's mission and vision statement, that's one of the things that you want to look at. What is their North Star? What is the where that they're trying to get at? You really want to look at their goals and objectives and the how. The mission is the path and the vision is the destination. But the goals, that's really the milestone along the way. The goals translate to the lofty language of the mission and the vision. And it really creates that actionable, measurable steps that they're going to take. So in public health, we often use SMART goals. They have to be specific. They have to be measurable, achievable, relevant, time-bound. So they have to be able to address specific health outcomes in real time with real outcomes that are measurable and attainable. So like we do that every day in our real life situations, but some examples that we look at in public health is, are we able to reduce the prevalence of like type 2 diabetes in, a tri-county area? And if so, how can we get there? And what time frame can we put it there? We may look at the objectives, can we do it by increasing enrollment in community nutrition programs by 25% over, say, the next 18 months? Something like that. We may put it into something of that situation. We want to make sure that we're able to do what we say we're going to in the time frame that we're able to put it into. We want to make them measurable. We want to make them obtainable. And then some of the summary of the relationships that we look at, especially in community health or public health, is the values. We want to focus on the principles, the time frame, and why do we care about it? Some of the questions we want to ask is like, why do we care? We're looking at that mission statement, not just the function and is it presentable, but what do we do today that's going to make a difference? When we're looking at the vision statement, it's not just the aspiration that we're focusing on or the future that we want to send this company into, but where are we going? Where exactly are we going? And then with our goals, it's not just about the execution and making sure that our goals are going to be pliable short term, or that like we're going to be able to meet our long-term goals, but like, how exactly do we get there? How exactly are we going to get there? Like, can we actually have a plan that's actionable? Can we work the plan? So in the public sector, these statements aren't just, for marketing. They're really for accountability, because public health agencies are often government funded or donor supported. So these mission and visions, they serve as a contract for donor support, and they're contracts for the public, because they help to ensure that the resources, like for instance vaccines or educational materials, they make sure that we have clinical staff if we need it. They're being used in a way that remains true and to the core value, that they are helping the greater good, just like we say that they're going to. So without this alignment, an organization suffers from the mission creep, right? So mission creep is where it tries to do so much that it actually kind of loses itself, or it loses the impact that it tries to have, and then the core health issues that it was created to resolve kind of get lost along the way, and then they end up not resolving any of the issues. It's mission creep. So during your practicum, you're no longer just studying health outcomes. You're really observing those mechanisms, that you really are diving into them. You're the public health professional, and you're out there, and you're going to be using social and behavioral constructs, and you're going to be able to understand why people do what they do, and you're going to be putting that into how their environment dictates their choices. So the most crucial construct to keep in mind during your rotation is the social economical or the social ecological model, also known as the SEM. This is really the big picture. It just really reminds us that health behavior is not just an individual choice. It's a product of multiple layers of influence. It's intrapersonal, which is the knowledge, the attitudes, and the skills. It's interpersonal, which is, your family, your friends, your social networks. It's organizational, which are your rules and regulations of the clinics or the schools that you're working toward, or you're visiting, you're working within, right? It's also your community, which are your cultural norms and your built environments. Like maybe you're looking around and you're like, dude, there's not any sidewalks out here. So older people can't get around very well, or younger kids can't go out and play. It's not safe to cross the street. It's not safe to leave your homes. Traffic is too much. Maybe it's something that you've looked at there. Maybe it's public policy. You want to look at local, state, and federal laws. Plays a part in what you're doing. Here's some tips for your practicum. When you observe a health issue at your site, ask yourself, is this an individual problem, or is this a policy and an environmental problem? Is this an individual problem, or is it a policy and an environment problem? Because that's going to really give you a direction of which way you're going to go. Because we walk into our practicum sites and we have this idea of what we want to do, and then we relay it to our sites. And it may be a site that we work at. For me, it was not a site that I worked at. I worked at a college. It was not a public health site. And so I was like, oh golly, what do I want to do? And so for me, I was Midtown Birmingham, Alabama, and there was a huge, huge epidemic of homeless people. So I knew I wanted to work in that area. So I quickly learned that that area was much larger than I thought. And so what I had an idea to do quickly turned into something very much different as I was in practicum. And so, practicum is a time to where what we think we want to do can turn into something much different. And so our ideas can turn into something different, and our studies can turn into something much different as we're out there. So just be open-minded during your practicum rotation, and don't always think that it's going to have to be this, it's going to have to get through it. I only have 80 hours in this amount of time frame. Because reality is, yeah, you only get 80 hours in 11 weeks, but that 80 hours, man, you can do so much in that time frame. Right? So as you interact with your community members, or as you analyze your program data, look for these 3 cohort constructs. Look for self-efficiency, that social cognitive theory. This is that individual confidence in your ability to perform a specific behavior. So in the field, a patient, they might know that they need to check their blood sugar, but if they don't feel like they can physically use their lancet correctly, they lack that self-efficiency, so your practicum work might actually involve creating tools to help them build confidence. Maybe it's showing them how to work it themselves, or putting them in touch with someone that can help them do that, or keeping that ongoing engagement with them to give them the confidence skills that they need, right? Maybe it's perceived barriers. This is just the health belief model. So the health belief model really suggests that people weigh the costs of a behavior against their benefits. In the field, we focus on perceived benefits like exercise makes you live longer. But in a practicum setting, you will likely see that perceived barriers like I don't have childcare or the gym is too expensive are much more influential than exercise helps you to live longer, right? I can tell you that I know that I'm supposed to exercise because I have heart issues, and yet I find myself, I just don't have time. Yet I have time for other things in my life. So these perceived benefits or perceived barriers are much way out heavier than perceived benefits. So find a way, if you're seeing these perceived barriers, find a way to get around that, and then implement that into your study if you need to, and what that looks like, right? You may be out there and you may be experiencing subjective norms, these theory of planned behaviors. This is just the belief that people like me to do things like this. So in the field, you may be working on a vacation campaign, or vaccine. You may be working on a vaccination campaign, which is the most powerful driver, which isn't always the science. It's the subjective norm, actually. Whether the person's peers and family are also getting vaccinated. Maybe they're from a hippie commune. I'll give you an example. We were doing just this at one point. I had a group of students that were out there, and they were looking at a group of students that were coming into kindergarten, and they were not vaccinated, and they're trying to figure out why. And then they realized they were coming from a commune or hippie commune, and the parents did not believe in vaccination, and it was because no one in that commune believed in vaccination. And so that came through to subjective norms, theory of planned behavior. And so that was a big portion of that study, was because their peers and their families did not believe in vaccination. And so that was something that we looked at with that study in that group, and how that affected everyone else. So things like that could be something that you want to look at and take into consideration. Social determinants, are some things, SDOHs. So while behavior constructs focus on why of actions, focus on the conditions of life, in your rotation, you may observe how these constructs intersect, the economic stability. Does the behavior require money or community doesn't have? Maybe it doesn't have any money to build sidewalks, or the city doesn't have it. Maybe the community maybe it wasn't so much that they didn't believe in vaccinations as a whole. Maybe they just didn't think that they could afford vaccinations as a whole, because they grow their own food and make their own money. They live 100% off grid, and most of them didn't have jobs outside of the community unless they were making something by hand and selling it at craft fairs or something. And then social and community context. Is there a high level of social capital, trust and cooperation in the neighborhood that you're serving. You got to build the trust in order to build the communication. You got to build the trust and you got to build the communication. It's kind of go hand in hand. What does that look like? And then during your rotation, try to perform a quick behavioral diagnosis on any program that you encounter. Like, ask, what is that target behavior? So maybe you're attending a prenatal checkup, and you want to ask those questions. What are the constructs at play? Is it a lack of self-efficacy or is it a perceived barrier? Like, for instance, is it a lack of transportation? So if it is a lack of transportation, maybe the person really wants to do what they're supposed to, but they just don't have a transportation. Maybe they don't need you to give them a pamphlet for education. Maybe they need you to give them a bus ticket, or maybe they need you to set them up with, a free ride, bus sharing ride or something. Something like that would help them more than anything else. So things like that you need to look at. What is the target behavior? What are the constructs at play? And how can you intervene and make things better for them? When we're looking at understanding context and stuff, behavioral science and public health isn't just about changing minds. It's about understanding the context itself. You use your time in the field to look at the past in the individual and see the constructs that are shaping the health of the entire population as a whole. So some examples when we look at community needs and assessments, you can do something like a windshield survey, and these are some things that we've seen some students do in the past. So it's windshield survey and a built-in environment audit, chronic disease management and barriers assessment, some occupational health and safety needs assessments, some adolescent mental health and social media use. So as you prepare to transition from the classroom to your practicum sites, you're moving from the study of public health into the theory and practicing it in reality. One of the most vital skills that you'll develop during this rotation is the ability to conduct a community needs assessment. So think of this not just as like a data collection task, but, just kind of like this diagnostic for an entire population. Just as a clinician examines a patient to find like a root cause of an illness, as a public health practitioner, you're really just kind of examining a community to identify just these gaps between current health status and this ultimate well-being that you're trying to provide. So as we've discussed in Module 1 in the first class live lecture, I hope that you guys have watched it by now. I know several of you may have not, but that's okay. I'm hoping that you will soon. As I discussed in that, the processes that we go through in public health, it's really anchored by a organization's mission and vision statement. And that's what we're talking about in this module too, is their mission and vision statement too, and the assessment that ensures that our organization functions really just remain aligned with our core values and just that equity and that social justice that they have. So it's not really just about looking at health outcomes, but by being able to apply that social and behavioral constructs that we've been learning and that you've learned throughout your entire MPH program. That social ecological, I'm getting so tongue-tied, it's such a late day already. That social and social ecological environment, it just really helps to dictate whether a program succeeds or fails, to be honest. Whether you're conducting a survey of a local neighborhood or you're mapping out like some type of resource, a maternal resource or whatever that you're doing, the assessment, it's really a foundation upon which you build your goals and objectives for the rest of your rotation. So let's kind of look at some ways that you can identify some specific needs. Like I said, these are some things that some students have done in the past that have worked out really well. Like when we do the windshield survey, when I talk about that, it's just really you're targeting a population. And you're saying you're walking into a population and you're looking at that population and you're looking at the community needs and you're assessing it. And you're like, hey, this primary data collection, and you're thinking that, okay, maybe this community needs something like a sidewalk done to it. And you're like, okay, well, we know that they can't get around because the traffic's too bad or the roads are too bad or they don't have enough sidewalks, and so it makes it hard for people to maneuver, and they don't have enough money in this community, so they don't have enough spaces to get cars to get back and forth, and they're a rural community, so they don't have any type of like taxi services or buses that run through here, things like that. And so you have a focus area. And so maybe you're thinking they don't even have farmers market out here, so they don't have accessibility to like a good local grocery store. They don't have a way to get to the good local grocery store to get good foods or whatever the case may be. So you have that focus area that, hey, they could use a good sidewalk. And so they have a barrier by not having any type of a good sidewalk or any type of communication or transportation. So because of that, now you want to do a environment audit. So you've looked at the windshield and said, hey, this is the problem that I've noticed. They don't have any means to get to good foods or healthcare services, and this is the reason why. They don't have sidewalks, they don't have public transportation. And so you look at all of that, and then you think, okay, what can I do to kind of bring things together? So then you kind of do like this triangulation survey, and that's where you bring things together and you kind of just analyze it. You kind of put it into like a quantitative, a qualitative, and then kind of like a secondary data spot together. And so by doing that triangulation, you're creating a robust type of data spot where you're not only identifying the area that you need, but you're creating that almost fail-proof. So you can use some statistics like from the CDC, from your local health department, from quantitative data. You can use like short surveys and polls. What does the community say about it? Are they interested in getting better things? From qualitative, you can go in and do key information surveys. You can do interviews, things like that. So, and it's all about triangulation. Maybe you're looking at something like chronic disease management or barriers to assessments that way. When you're looking at things like that, you may be doing something like maybe investigating low participation rates at a local mobile mammogram unit or something, or maybe you're looking for free diabetic, free diabetic testing or screenings that can get out to the rural areas and stuff, So like your project would be like investigating like low participation rates in local mobile mammogramming or free diabetic clinics, right? So that would be something that you're investigating. And so your focus areas would be like all of those rural community areas, And so then you would look at your perceived barriers. Maybe it's because they couldn't go to mammogram screenings because they have, lack of childcare, or maybe they have, fear of diagnosis, or maybe they, live too far out and they can't make it to town, or whatever the case may be, right? And so then you look at, well, how would your testing be? So you'd have like a set of evidence-based recommendations, and then you would have to have the clinic and reach out hours and, messages to help improve health equity and things like that would go a long ways. And then again, you would still want to do that triangulation so that you would have a good study on that, qualitative, quantitative, and then like, the different interviews and stuff like that you would want. When we look at occupational health and safety needs, maybe you want to identify something like some physical or mental health risks among specific subsequent employees. Like, okay, so like what I mean by that is like maybe you're in a warehouse or you work in a warehouse. You can even do public health safeties at a warehouse if you wanted to. Maybe you're working in a warehouse and you notice that, hey, there's a whole lot of back strains or people going down on back injuries because they're not wearing back belts. Something simple as that. Maybe you're noticing that they don't have a night shift nurse on hand, so maybe your focus area is like having a night shift nurse on hand to help teach ergonomics or risk factors, Maybe it could be healthy foods for late night shifts, healthy snacks or something like that, things like that. Being able to propose workplace wellness interventions or something, being able to take a break during work hours so they can learn, stretching exercises for back relief and building up back muscles or something like that. And then if we look at something like if you are looking at something like with adolescent mental health or social media, I know social media and adolescence is a huge topic these days. It's been a huge topic since about 2010, 2012, whenever social media really hit the high school stage, especially with the female especially with the rise in suicide rates, especially with young females, being acclimated to social media use and stuff. And then the link to it being fear of left out. So maybe you want to do something like that, or you're wanting to link it to something like that, so you can do like a timely project focusing on social determinants of health and peer influence or something. Maybe you want to do something like partnering with a local high school or a youth center to assess the impact of digital environments on student well-being. You could do something like assessing the prevalence of cyberbullying. That's huge in high schools right now. I have 2 twin goddaughters that have both had to quit high school a year early and take online classes because they were both bullied unmercifully to where they were no longer safe to be in a regular high school. And they had to step out. And even though their high school they went to had zero bullying tolerance, the bullies got away with it because it happened off of school grounds, because it all happened online. And there was no escape for these girls. It was 24/7 all the way. And so, maybe it's a peer-led advocacy strategy that you want to do, or maybe it's a digital wellness toolkit or something like that, Maybe you want to do something on resource mapping for maternal and child health. Maybe you want to evaluate support systems for postpartum mothers in a specific zip code. Maybe it's a whole culture of a non-speaking English class or something. But I'm just saying, anytime that you do a study, try to use a triangulation method if you can, so that you can make your assessment very robust, and that you can try to use 3 types of data. You want to use statistics from like a CDC or like a census or a local health department if you can. A quantitative primary data, so like you want to use like short surveys or polls, and then of course again a qualitative primary data, so that you can have your key informative, your interviews, things like that. So I hope that all of this was helpful for you. I hope that you just take away from this little lecture tonight that community needs assessment is just something that a practicum requirement is the bridge between empathy and impact. Really is what it comes down to. It's just being able to identify the gaps in a community where you ensure that public health interventions are just never that one size fit all kind of antonym that we see a lot of times, because it just really isn't. My oldest daughter, she's 29 and she's worked on her 3rd master's, and when she was getting her master's in public health, one of the things that she started in her undergrad in international public health, and she got her master's in global public health, was the use of opioid. And the fact that they no longer, when they come off of opioid use, they don't get good dental care in a particular zip code that she was in. And then she ended up setting up international dental care, interchangeably international dental care, and she was able to get published with her studies on that and what that looked like after so much time clean from opioid use and stuff. So it's very interesting. So this is what I'm saying. You want to systematically look for those gaps in a community that you can ensure that public health interventions are never that one size fit all. Instead, you want to really tailor to be specific to that social behavioral reality for those people that you serve. Like my oldest daughter, she was serving the opioid epidemic or pandemic, really, because it was global, and she wanted to make sure that she served a certain population, and it started out in a certain zip code, and then it grew, and then it was a certain age bracket, and then it became a certain gender, and then from that it just kind of grew again, and that her study went on for years, and then it became to where she set up different clinics globally, and then she partnered with different dental students that would come in and put the implants and stuff in, and it was just really amazing what all it just triangulated and went on and stuff. But one of the things that she had to make sure that she spearheaded and kept in her front foremost of every one of her studies was every organization that she partnered with, she had to make sure that she was very clear with their mission and vision statements. That had to be in the forefront of her mind at all times, just like it has to be in the forefront of your mind at all times, because that's what you have to use to help guide you with your observations and ensure that your findings help to reflect the core values and the equity that you're serving. So you have to make sure that you no longer just observe the population, that you are advocating for them. So by understanding the constructs of the behavior that and the determinants of the health, that you are equipped, that you're turning your data into the strategy, and that you are truly moving that needle in the public health outcomes that you're trying to solve. And that's really what you're trying to do. This isn't just about passing a practicum class and gaining your master's degree. This is about really creating something that will turn into something monumental. When I tell you that my daughter started it in her undergrad, it rolled into her graduate degree. At that point, she went into her second master's, and she continued to work on this research study long after, for years after she graduated. It turned into her moving into living in different countries, being employed by different public health entities along the way. And it was just really amazing what can really take off and move from your practicum rotations, from the studies that you're doing right now. So always ensure that your assessments and your goals match your organization's mission. Always analyze, make sure that your behavioral constructs, like your self-efficiency and stuff, explains the whys of the behaviors that you're trying to incur. Always use your findings to recommend your actionable and your community-centered solutions. I can't say that enough. It's amazing what you can do in this space that you're giving. As always, please feel free to reach out to me no matter what. I was always here to answer questions and to be of help and of service to you. Thank you so much.